As you can see in this image, we have a right ovary and a left ovary. Your right ovary is normal, your left have a dermoid cyst growing on it. Here's another picture of the ovaries. You can see the normal ovary, and then you can see an ovary with the cyst inside, growing inside of it. There are many types of ovarian cysts. Just to mention a few, you have follicular, which has to do with the follicles. You have corpus luteum, which has to do with the menstrual cycle. You have endometriosis, which is a cyst growing outside the lining of the ovary, or sometimes in the fallopian tube. Then you have polycystic ovarian syndrome, which is many cysts growing inside the ovary. And of course, you have dermoid cyst, which is also known as a teratoma, which is my main topic today. So it is a monstrous growth. It was first described as that due to the contents inside of it. As you can see in this picture. In this picture you have a whole dermoid cyst that it was removed. Once they take that lining, then this is what it looks like. And what the contents inside of it, this is it. So that's why it's called monstrous growth. It mainly derives from the germinal layers, which if you used to remember biology, you have ectoderm, the endoderm, and the mesoderm. Now I guess the good thing about this type of growth is that it is mostly considered benign, or most of them are considered benign tumors. Now, since it happens during the embryonic development, you can bet that it's present at birth. Again, you get all the structures. You get skin, you get nerves, you get muscle, you get bone side of this, thyroid. You get all these structures from these germinal cells. Usually it develops during the child years. Since it's present at birth, it usually develops during the childbearing years, which sources indicate that it occurs somewhere between 14 and about 45 years old. So they're not very, different sources indicate different timings, but it's going to be present at birth, so it's going to have a slow growth rate, so it'll grow during those years. Some of the most known complications is torsion, and which leads to rupture, which leads to infection, hemorrhaging, and infertility, and sometimes malignant transformation. So torsion is the twisting of the dermoid itself inside the ovary. Sometimes it gets too big, it starts to run out of room, and since we move around, then it's going to start twisting. Once it gets too twisted, then more than likely it's going to cut its own blood supplies, which at that point is going to rupture. Once it ruptures, then it's going to spill all of its contents inside the ovary. Spilling all of this content is going to more than likely infect the ovary tissue. If there's and since it ruptured, then you're going to have hemorrhaging of the lining of the ovary, and at that point you really need medical intervention. And since it really destroyed, since the rupture itself destroy the ovary, then you're going to have fertility issues. Sometimes, according to data, there have been some cases where dermoid cysts have transformed into malignant, but it's very, very slow possibility, or a small possibility. So some of the signs and symptoms, it's mainly asymptomatic because it has a slow growth rate. When you do have symptoms, it's more than likely going to appear after either you have torsion, which we just talked about, torsion and rupture. At that point you have abdominal pain, and if there was rupture to it, then its contents going to create some type of infection. At that point you'll have some infection symptoms. Most of the time this type of mass is discovered through accident. And usually when you're getting some other study done. Now, if ultrasound is the first modality that is used due to the lack of ionizing radiation. And once they discover it with ultrasound, then they can do a CT scan study. CT scan study is just going to show more detail about the dermoid. They can see it from different angles. Once they discover, they can measure it. Once that, they can use MRI. MRI is mainly used to show whether the dermoid is malignant or if it's benign. Sometimes it'll appear in X-rays. In this type, it'll be some kind of accident. You get an X-ray and by accident you see this type of mass, and and you can see that type of mass because it has bone such as teeth and then cartilage. You can see those structures in there. Treatment, there's really only two types of treatment, and they both involve surgery. You have laparoscopy, which is down with the scope. Then you have laparotomy, which is open surgery. Laparoscopy is usually the first choice due to cosmetic reasons, because of less scarring, and usually the hospital stay is shorter. Then you have laparotomy, which again is open surgery. It requires making an incision into the body and going in and removing the whole mass. The operation is actually shorter than laparoscopy, but since you're cutting through the body, then you're going to have more complications such as infection and all this sort of things. I guess if you get anything from today's presentation, have your regular checkups, especially if you want to have children anytime soon, or if you just plan to have children in general in the future. So that way, if you do have some type of growth mass in your ovaries, then you can discover at early stages and you can start managing that. Well, that's the end of the presentation. Thank you for your time.